What if I told you that in the next 2 years, every patient, every doctor, every hospital, and every healthcare system will rely on artificial intelligence, not just occasionally, but every single day? What if I told you that AI will write clinical notes, interpret symptoms, summarize lab results, analyze medical images, automate patient follow-up, and rewrite the entire workflow of healthcare behind the scenes? And what if I told you that despite all the hype, not all AI tools are created equal? Some AI systems are perfect for patients, some are ideal for physicians, and some are the closest we've ever come to clinical-grade medical intelligence. I'm Dr. Saab, a board-certified family physician and clinical informatics specialist, and in today's deep dive, I'm going to break down the most important question in modern medicine. Which AI belongs where? We'll cover which AI is the safest for clinical decision support, in which AI is best for doctors and healthcare providers, which AI is best for patient education and symptom guidance, in and which AI models hospitals and enterprise systems are adopting. This is the ultimate 2025 guide to the best AI tools in healthcare, fully explained by a physician. Before we talk about the best AI tools, we need to understand the landscape. Healthcare is changing faster today than at any other point in history. AI is no longer optional. It's becoming a requirement. Here's the reality of 2025. Patients are using AI before they ever see a doctor. They're asking ChatGPT, Gemini, Claude, and even Grok about their symptoms, diagnoses, and treatments. Doctors are using AI to reduce burnout, especially for documentation and inbox overload. AI is relieving that pressure and giving clinicians time back. Hospitals are digitizing everything: scheduling, triage, risk prediction, and care coordination. Regulators are catching up. We now have early FDA guidelines for LLM-based tools and medical-grade AI. And finally, AI models have become extremely specialized. Some models excel at reasoning, some excel at visual analysis, some are safest, some are fastest, some are built for consumers, others are clinical grade. The question isn't which AI is best, it's which AI is best for which situation. Using the wrong AI for the wrong task can be unsafe or useless. That's why we need a category-by-category breakdown. Doctors, patients, hospitals, and health systems all have different needs. No single AI model can satisfy all of them. Each model has a strength and a purpose. This video will match each AI model to the job it does best. Let's begin with the most important category of all. Claude 3.7, safest for clinical reasoning. Clinical decision support requires the safest, most cautious, most reliable AI available. If I had to pick one model for pure clinical reasoning, it would be Claude 3.7. Claude has the lowest hallucination rate across clinical datasets. It's conservative. It's careful. It tells you when it doesn't know. And in medicine, humility saves lives. Claude structures medical reasoning the same way clinicians do. It breaks cases into epidemiology, chief complaint, red flag, and risk factors. Then it lists likely and less likely diagnoses. And finally, it suggests evidence-based next steps. Claude excels at summarizing medical text. It can parse chart notes, labs, radiology reports, and consults. It extracts structured information a clinician can use immediately. Claude follows guidelines AHA, ACC, ADA, USPSTF, Gold, IDSA, ACOG, and more. It aligns with standardized medical frameworks. It also avoids fabricating studies, a common problem in other models. Claude refuses to be overly confident. When unsure, it explains its uncertainty. This makes it the safest option for clinical decision support. Claude is built for caution, not speed. It flags emergencies reliably, and it avoids making direct treatment recommendations. That's exactly what a clinical AI should do. Claude is ideal for symptom checkers, triage tools, and decision support systems. It powers key parts of my own My AI Doctor app. In medicine, safety is everything, and Claude leads the field. Example: a 58-year-old man reports chest pain at 2 a.m. Claude flags red flag symptoms and instructs him clearly to seek emergency care without guessing a diagnosis. Example: before a diabetes follow-up visit, Claude produces a one-paragraph summary of a patient's A1C trends, medication adherence, and complications. Example: An oncologist uploads pathology and radiology reports. Claude extracts tumor type, stage, prior treatments, and key questions for tumor board. Example, a pharmacist checks if antibiotics are appropriate for a viral URI. Claude references guidelines and recommends documentation language to avoid unnecessary prescriptions. Example, a patient uploads a confusing discharge summary. Claude rewrites it in simple English, helping them understand their condition safely. GPT 5.1 and o1, taught for providers. Doctors don't just need answers, we need automation. We need workflows, coding help, integration, and tools that perform tasks. GPT 5.1 and the o1 reasoning models excel at this. These models offer unmatched long-chain reasoning. They automate documentation and practice management beautifully. Doctors can use GPT to draft patient messages, care plans, and educational materials. GPT helps create templates for chronic disease management and visit summaries. Where GPT shines brightest is coding and automation. If you're building an app, GPT becomes your technical co-founder. It writes Flask apps, APIs, thunkable logic, WordPress automations, and backend scripts. GPT integrates elegantly with EHRs, Epic, Cerner, Athena, eClinicalWorks, Dr. Chrono, and more. It can generate macros, smart phrases, and structured note templates. OpenAI's agent frameworks take this to the next level. Agents can log in, extract data, cross-check information, and perform multi-step tasks. This is the future of clinical workflow automation. GPT is the doer model, an AI that gets things done. It reduces burnout for healthcare providers. It scales across all specialties. If Claude is the safest thinker, GPT is the smartest assistant. Doctors save hours every day using GPT. It frees time for patient care instead of paperwork. It improves accuracy and reduces errors. No model boosts clinician productivity more than GPT 5.1. That's why it's the #1 model for healthcare providers. GPT is the engine behind modern medical efficiency. Example, telemedicine doctors upload visit recordings. GPT generates complete SOAP notes in seconds. Example, MyChart inbox messages are overwhelming. GPT drafts safe, guideline-based replies that clinicians approve. Example, a cardiologist needs an insurance appeal letter. GPT creates a professional evidence-based appeal citing guidelines. Example, a family physician asks GPT to create smart phrases and reusable templates for common conditions. Example, a doctor wants to build a risk calculator. GPT writes the full Flask app and deployment instructions. Gemini 2.0 vision, best for patients. Patients need clarity, safety, simplicity, and visual intelligence. They don't need deep diagnostic reasoning, they need understanding. Gemini is perfect for that. Gemini is the best multimodal vision model available to consumers. It analyzes pictures of rashes, medications, food labels, swelling, burns, and more. It explains findings without diagnosing conditions. Gemini simplifies complex medical language beautifully. It translates labs, imaging, and diagnoses into everyday English. It uses a patient-friendly tone that reduces anxiety. Gemini also has real-time search built in. Patients get updated medical information quickly. Gemini supports voice, video, images, and multiple languages. It's highly accessible. Patients don't need the most powerful model. They need the most understandable model. Gemini teaches without scaring, guides without diagnosing. This makes Gemini ideal for patient-facing education. It empowers patients to communicate better with their doctors. It helps reduce misunderstandings and confusion. Gemini is the best AI for patients today. No other tool balances clarity and accuracy like it. Example, a woman uploads a photo of a rash. Gemini highlights warning signs and explains when it's safe to monitor versus when to see a doctor. Example, a patient gets confusing lab results. Gemini explains ALT, triglycerides, and HDL in plain English. Example, an elderly patient takes a photo of a pill bottle. Gemini reads and explains the instructions safely. Example, a Spanish-speaking patient uploads an English discharge sheet. Gemini translates it at a simple reading level. Example, before an orthopedic visit, Gemini suggests smart questions the patient can ask their doctor. Amazon Nova and Bedrock, enterprise leaders. Hospitals need safety, stability, and hypercompliance. This is where Amazon dominates. Amazon Nova, HealthScribe, and Bedrock are built for enterprise healthcare. They handle medical transcription, note generation, and back-end automation. They integrate deeply with EHR systems. Amazon's uptime and reliability are unmatched. Hospitals don't choose hype, they choose stability. Amazon's models are designed for large-scale clinical systems. Bedrock lets hospitals safely test multiple models in one secure environment. That's why Amazon is winning major healthcare contracts. Example, nurse line phone calls are transcribed automatically, summarized, and routed to charts using HealthScribe. Example, in-clinic visits are automatically transcribed into structured notes from live audio. Example, AI flags critical radiology findings for immediate review. Example, overnight analytics identify high-risk patients needing proactive outreach. Example, hospital innovation teams use Bedrock to compare models like Claude and GPT securely with PHI. Now let's talk about Meta AI and Grok, two important players. Meta AI is great for developers and consumer tools, but it's not medical grade. It's excellent for free tools, social media, Q&A, and on-device AI. Useful for non-clinical triage, not clinical reasoning. Grok AI shines in real-time trending information. It helps surface health misinformation and public sentiment on X. But it's not meant for clinical tasks. These models have roles, just not in medical decisions. Each belongs in the consumer and public health ecosystem, not clinical care. Example, clinics use Meta AI on Instagram and Facebook to answer insurance questions in clinic hours. Example, a WhatsApp bot using Llama reminds patients to take medications and watch short educational videos. Example, public health departments use Grok to detect trending misinformation about vaccines. Example, Grok identifies what worries patients most during flu season, guiding public health messaging. AI will handle 70% of documentation within a few years. Symptom checkers will evolve to voice, image, and video-based assistants. AI co-pilots will become part of every EHR. Wearables and smartphones will detect disease earlier. Patients will have personal AI health companions. Telemedicine will be AI first, human assisted. Doctors will supervise AI-generated care plans. Preventive care will become predictive and personalized. Consumer platforms will shape patient behavior, and health systems will adapt around AI tools quickly. The future of healthcare is intelligent, personalized, and AI-driven. Example, a patient with diabetes wears a CGM. AI notices rising glucose and sends educational prompts, not medical orders. Example, a surgery patient gets daily AI check-ins with recovery reminders and red flag warnings. Example, telemedicine triage begins with AI collecting structured symptoms before the doctor joins. Example, a cancer survivor gets a personalized AI coach for lifestyle, reminders, and emotional support. Best AI for clinical use, Claude 3.7. Best AI for healthcare providers, GPT 5.1 and o1 Reasoner. Best AI for patients, Gemini 2.0 Vision. Best for hospitals and enterprises, Amazon Nova plus HealthScribe. Best overall ecosystem, a hybrid system using multiple models. This is the foundation of the MyAI Doctor app. In healthcare, accuracy matters, safety matters, workflow matters, trust matters. AI is not here to replace doctors. It's here to restore time, clarity, compassion, and connection. That is the true purpose of AI in healthcare. Example, my AI Doctor uses Claude for safety, GPT for workflows, and Gemini when visuals are involved. Example, a patient with knee pain receives a structured educational summary, not a diagnosis, so they can talk effectively with their physician. Thank you for watching this deep dive. If you're a patient or doctor who wants to use AI safely and effectively, subscribe to the channel. Try the My AI Doctor app at https://app.myadoctor.ai and stay ahead of the future of medicine.